entering shortly into St. George, which is the capital of Grenada. Grenada is about 20 square miles larger than Staten Island, with a population of approximately 100,000 people. Where Staten Island, 20 square miles smaller, has a population of 400,000 people. Grenada is located 150 miles north of Venezuela in the Caribbean. That yellow building with the red top is the hospital. And they already have a boulevard named after Mr. James, who won the 400 meter this summer in London. We're now entering St. George's, the old port where most of the commerce takes place. This area is also known as the Carnage. This morning's itinerary is we'll be leaving the compound and going over to St. George's University, meeting with the clinical director, actually he's Director of Clinical Affairs, Brendan Lagrange, and then follow that by my son and I having an interview with the great local radio station. We're currently coming up on the American Embassy on the left.
Wild animals here.
This is the road leading up to St. George's University. Coming up on the right, we'll see shortly the veterinarian clinic from their veterinary school. They recently received accreditation for their students of veterinary medicine. These are some of the facilities in which the students are staying at right outside the campus. And they appear to be building more facilities here.
There's halls. These are dorms to the left and right, and these are different student housing, classrooms. Now we're going up Cardiac Hill. We gotta make sure we go quickly, otherwise we will not make it up the hill. And here are more. Take you around this way. Straight ahead is the library to the right. Left is more classrooms.
This is a monument to the soldiers that gave their lives during the invasion of Grenada back in 1983.
When I was a student here in 1993 to 1994, the only classroom that existed up here was to the right, with the stone facade here, the small one. And then this housed all the students, and then they built the building over there to the left with the clock tower. And those are the only two buildings at the top here.
We'll be going into the Chancellery building to see the Director of Clinical Affairs.
Bulletin out, do a memo, and then, you know.
Yeah, we're talking this morning with Brendan Lagrange, who is the Coordinator of Clinical Affairs here at the college, university. How long have you been doing this, Brendan?
We've been doing, well, I have been doing it for 5 years plus. we started the program around emergency medicine, and it's now evolved into a number of specialties and subspecialties, which somewhat goes into the history of how we met.
Yes.
Well, I don't know if you would like me to get into that.
You can get into it, go ahead.
Okay.
I don't want to blow my own horn.
At St. George's University, we started the emergency medicine program in which we invite board-certified emergency medicine specialists, alumnus, and in some cases friends and persons close to the university to come into Grenada and aid in the shortfall which we have in many subspecialties. In the case of emergency medicine, your son, Robert Helman, is a certified emergency medicine specialist who was one of the first to answer the call and recognize the importance in returning and doing what you can to assist in the improvement of healthcare delivery in Grenada. Subsequent to his visit, we had discussions because the prevalence of hypertension, diabetes, other similar ailments lead to many ailments of the extremities, especially the foot, leading to amputation. Discussions came up surrounding the podiatry specialty and where it may fit into the programs that we have. On immediate response to that discussion, the need was overwhelmingly needed, accepted as a critical need for Grenada, and along came father of Robert Helman, J. Helman, podiatrist. So we began communication, and within a year you were able to get your resources aligned and come into Grenada to do your first podiatry clinic. That is an experience, once again, I don't know if you would like to start, because from our end, we know it was an overwhelming experience because you came in expecting, well, the expectation on our side and your side would be come in, do a couple short clinics and wrap up, go home, do a report on what the experience was, plan for future. But when you came in the first clinic, you did started at 9 a.m. and went on to, I think it was 6 p.m. The other,
It was a long day.
yeah, there were non-stop long days on that visit.
True.
And I mean, you saw a number of cases, foot ulcers, from simpleness of ingrowing toenails right across to almost pre-amputation type cases and pre-OR type cases, most of which you were able to give intervention and assist in the rehabilitation of the individuals met. From that time, it has been, this is your fourth visit, I think, over the last 2 years, 2 to 3 years.
Actually, it's before, I come annually, so it's fourth visit over 4 years.
Fourth visit over 4 years.
It just time flies.
Time, it does. And in each visit, I mean, the clinics where Grenada is a developing nation, we try to assist in the procurement and the provision of the healthcare specialties we deal with, but in many cases, all the needs are not able to be met. And in your case, you have been able to, on all of your visits, travel with adequate and sometimes more than adequate supplies to take care of your medical needs to assist in the clinics that you provide. So from the St. George's University perspective, the podiatry arm of our program has been very successful. From the ministry standpoint, it has been extremely welcomed, and it has almost become an annual expectation. The nurses at the rural clinics know you by heart and by name, and they await the annual, and in future planning, we intend to expand to more than once a year to maybe 2 to 4 times a year, quarterly visits. And
Anyway, so the program this time is I'll be going to three clinics,
yes,
and you're going to be doing a radio interview with my son and myself later today. Is this radio interview strictly for the campus, or is it for the entire country?
the radio interview, it will be aired countrywide. The SGU radio band is 107.5 FM. It is in final beta testing for internet play, so we expect in the not too distant future that it won't be just ready through the standard FM frequency, but also as an online radio station. So it will be available for local, regional, and international. And we've had requests from SGU alumnus and persons who have become associated with St. George's University to tap into the radio frequency and be in touch with Grenada.
Very good. Well, thank you, and we'll see you tomorrow for the first clinic. This is the library. Students study here at various computers, journals. We're now headed down. These are more dorms on the left, and we're going down to the student bookstore, possibly the infirmary, where I'll be working tomorrow. We're now entering the commissary where students can get their meals.
I don't believe in unity, I'm not gonna lie. No, I get it.
Halfways and probably felt that because I really trying and halfway.
It should be noted that the university consists of an undergraduate and graduate program, as well as a medical school, veterinary college, and nursing school. This is all developed since my son was here in the early 90s. We're back at the campus, and we're going to be going this morning to the university's infirmary, which is at that. This here is the veterinarian school here.
You doing, buddy?
I'm trying to do a documentary of the trip, so that people back home can see what they're doing. Dr. Good morning. It's always good to see you, sir. Thank you very much. All right, appreciate it. Just got this time I'm interviewing implementation. So if I need a scalpel or some sort of tissue nipper or something, you have it. Right, that's what I figured. You guys are pretty well covered.
We have some sterile parts here. We also have sterile parts here. We have added instruments.
Once again, these are the clinics where the St. George's University staff and students come for their medical care. Quite modern. Here's an exam room.
I had to shut down the last time. We'll now be entering a tunnel that connects one side of St. George to the other. This is both pedestrian as well as vehicle. This morning I'll be going to the St. George's Health Clinic to see patients. This is the room we'll be working in. This is typical of what the shelves are like. Totally different from yesterday. We're on our way to Tivoli, the clinic on the other side of the island. It's 18 miles from where we're staying. It usually takes about an hour and 15 minutes to get through the mountain to get there. Here we are at Tivoli. That's the local goat. Morning.
Good morning.
Morning.
We would have been here sooner, but not the town, and they should have told me they ended up sending people out there.
Hello there. How are you? Good morning. Good to see you again. This gentleman has had this venostasis ulcer on and off for the past 30 years. This recent attempt is at 6 weeks. Patient states that it's painful in the evening in bed. This ulcer has already been debrided by myself. We've controlled hemostasis, and we're about to apply Silvadene, dry sterile dressing, and you can see the hemosiderosis on the leg, the darkening of the leg as a result of the venostasis, which results in this ulceration. We'll be placing a compression dressing to stop the extravagation of fluid from the veins. This ulcer measures 4 centimeters by 3.5 centimeters. There are no signs of infection.
Right.
Hi, we're with a young lady here who's had a sickle cell wound for the past 8 years. Hasn't been healing. This particular wound is approximately 14 centimeters in length and wraps around her leg. We're going to be treating this wound with some meta honey, a alginated gauze, and an Uniboot to try and maintain compression and bring this to a healing state. Thank you. We're stopping by the local campus radio station to do an interview today.
We're once again having another interview with one of our visiting faculty members. This afternoon we have with us Dr. J. Helman, podiatrist. Good afternoon, Dr. Helman.
Good afternoon, Brendan.
And how are you doing today?
Very well, very well. Before I start, though, I'd like to thank you and St. George's University for the invitation and the opportunity to come down here and see the school and serve the community.
It's been a pleasure having you, and I know, even though the listeners out there don't, that this is not your first year, it's actually your fourth year being back. So, given that you're now an honorary Grenadian, can you give us a little insight into what led to you being here and doing your special need to the people of Grenada?
Well, actually, my son Robert is a graduate of St. George University. He's an emergency room physician. He's been coming down here for a number of years and presenting lectures to the casualty doctors. And it was through him that he suggested that I come down. There was a good need for wound care, which is a big interest of mine and something I do back in the States. And as a result, as they say, that's what brought me down. And as my son would say, I never did visit him when he was a student here.
Sounds like a long, hard-lived family story. Okay, Dr. Helman, on this visit you've done a series of clinics both at the university, in the town of St. George's, and out of St. George's. Can you give us a little look into what are some of the problems you did notice with regards to wound care and the foot?
Well, there's a tremendous need for basically a wound care clinic down in here, in Grenada. Most of the patients that I've seen are diabetics or have sickle cell disease. The majority of people, though, seem to have venous stasis ulcerations and have had long-standing ulcerations with their comorbidities for many years, many of them dating back as long as 30 years. Some of them have never healed from it, some of them heal from it and then they break down again. So it's an important factor. The level of amputation rate throughout the world has been increasing. The reason for it is that medical care has gotten better. It sounds like an oxymoron, to where patients with diabetics are living longer, but as a result of that, they're developing peripheral arterial disease, they're developing hypertension, heart disease, and kidney disease, which results in swelling in the limbs, and in combination with neuropathy, these patients are prone to wounds that they're not aware of until one day they look down and their socks are wet. These wounds become very critical, and many of them lead to eventual amputations. Unfortunately, it's a situation that affects not only the individual but his family and the society as a whole, because once you're amputated and you're relying on society to support you and your family, it creates a drain on the local economy. So it becomes very important that number one, we try to prevent these injuries, but once they occur, we try to resolve them as quickly as possible.
Very good information for both the patient and the physician population listening to this program. I know you've had any improvements in the wound situations here.
Well, from my experience and for the amount of patients that I've been seeing each time down here, I've seen a definite improvement in the care. I think there's a greater understanding to both the cause and effects of these wounds. Many times you can't just treat the wound because there's a reason for the wound. And if you just treat the wound, it's like hitting your head against the wall. It's like taking the aspirin for the headache, but you got to stop hitting your head against the wall. So what I found is that many of my people that I've seen down here as patients have had a very high success rate in recovery once the medical staff fully understood and the nursing staff fully understood the consequences as well. Well, I think they always understood the consequences, but they understood the etiology of the problem. And once we start addressing the etiology, we're able to resolve the issue.
I know, as we alluded to earlier, this is your fourth year coming down. Can we expect you back in the near future.
I don't know if you can keep me away.
Sounds lovely. That's just what we like to hear. Food for thought. Okay, Dr. Helman, on behalf of the Chancellor, Dr. Mordecai, the Provost, Dr. Penzick, and the entire St. George's family, from the bottom of our hearts, we thank you for the service you've been doing for almost half a decade. I know in interacting with the Grenada medical fraternity, you have reached, a great juncture in the wound care aspect of healthcare, and we look forward to hosting you and look forward to your services being granted and gifted to the people of Grenada. Thank you so much for being here.
And I look forward to coming back. Thank you for having me.
Thank you.